to the link. We're going to head straight into the Zoom room where Senator Sabina Perez is in the Zoom room. Good morning, Senator.
Good morning, Sabrina. Good morning, Chris, and to the listening audience.
Morning.
Another big day.
That's an understatement.
Right, at the legislature. Bill 112 going for round 2. What's your takeaways from round 1?
Yeah, so a lot of the testimony that came, a lot of doctors came out to testify opposing the bill. And, what transpired was a conversation about the state of our healthcare. I think that also needs to be addressed. A lot of the doctors raise the issue that they may perhaps be exposing themselves because they are trying to bridge the gap for coverage for those specialties that don't exist on Guam. And so perhaps the standard of care might be breached. And I think that's, Guam is very, very a unique place. It's very difficult to attract these specialized care. And, I think it'd be very difficult to do that. So what is the answer? I think that discussion needs to be also, sorry, my phone's ringing.
Nice ringtone.
That also needs to be addressed as far as the healthcare of our system. I see that, we may not be able to attract the specialties. So what is the answer to that, right? And do we? So I guess that puts our community perhaps at a certain risk if doctors are, expanding their services. And I think that could be perhaps. There could be answers to that. I think that consultations are definitely necessary, and that needs to be developed further in regards to that. But I think also to the access to any malpractice that occurs, patients should be able to access some sort of compensation. And so this idea of self-regulation, right, that there should be, the doctors definitely seem to say that self-regulation is what is needed. And we're seeing that the system that we have in place is not sufficient. So that needs to be also addressed. The question was, how does one determine whether a bad outcome is malpractice or other? And, when we go to the doctor, we always hear, go get a second opinion, right? And so at what point does one know that a difference in opinion is such versus an actual breach of standard of care? And I guess a lot of doctors responded that, because they are exposing themselves, because they're going out beyond their scope of work, that they would have to limit the care that they give their patients currently, because a lot of them would have to go off island and they can't afford to do so. And so I think we really need to address that too as well. So there was the discussion brought out a lot of points of the state of our healthcare, as well as we still need to figure out how to make those that have been that have suffered malpractice, how to make it more accessible for them.
It's what Senator, I guess, like the need, right? It's so hard to measure how many instances of, I guess, potential malpractice, because the arbitration process is so cost prohibitive that a lot of people, and we hear it, in interviews we've done, people believe they've been a victim of negligence or malpractice, and when they're told that, oh, you need, $20, $30, $40, $50,000, they're like, oh, never mind. So there's no way to measure how many potential, cases we could have, because, like I said, people are just getting locked out of the gate. So, when these doctors and they talk about, and I get it, right, that they're acting outside their specialty. I brought this up last week. Is like, what is there a risk? Like, how far outside are you practicing? Because it kind of seems like what they're saying is that because Guam is underserved and because we don't get these specialists, I might be trained in X, Y, and Z, but I'll do, a W because I'm just here to help. But when I do that W, man, I might, might not be the best Operation W you can get, but I need to be protected because I'm going outside of my scope. So
Yeah, and
it's
I
just,
think one
there's,
of
you're
the
right. It raised so many questions. Like that just made me have more questions about, well, how far outside of your scope are you going? And I mean, when you're being worked on or seen by someone who is not really like trained for that, what does that mean for the patient?
right, right. And so what's the answer if the patient can't go off island, right? And I think that's where consultation has to come in, and perhaps we can develop something as well as consent, right? So I believe one of the those that testified, one of the doctors that testified, he mentioned take a look at Georgia's law where it talks about consent. And Guam is very unique because we can't just drive to the next jurisdiction. We have to fly, and that costs a lot of money. And so we have to develop a system in place to address that situation. I agree. But in regards to not having access, that is, I guess, a failure of the system. Not having access to compensation that is for malpractice. That is a failure of the system. There's a lack of feedback, right? If the system does not allow for that type of self-regulation to occur or regulation to occur, then we really, are leaving a lot of these patients who have suffered malpractice without any form of compensation. So that definitely could be addressed. I think there are ways to address everybody's concerns. I think also the Bill 1112, as the speaker, she put out a press release today trying to explain the bill. And I think there's been a lot of fear surrounding it. I think some of it has to do with, the lack of specialties. And the other thing is that, I think the bill could be developed further to address the fears of doctors and to also create a system that's more functional. But yeah, again, the discussion of how to move forward, because I know, doctors, their reaction is they're going to limit their services based on their training. And so that's going to leave perhaps a lot of people in the community without the care that they need. There's also talk about, as far as care, I agree that preventive care is always the way we should move forward. I mean, that's another discussion. But
Oh man, Senator, let me tell you, I ran into this doctor. I went out for a drink Saturday, and I ran into this doctor, and we were talking, and this doctor is a surgeon who obviously was schooled off island and continues to work off island. But she was saying that Guam's population, and I'm gonna maybe a little oversimplify her point, but just to be fair, to put it out there, she was saying that Guam's population is so sick, and it's true. I mean, we've got all these comorbidities. We saw it in COVID, right? How delicate everyone thought our population was because we're ill people. We're very sick. We got hypertension, diabetes, all of it. And so she was basically saying that we're not really in a position to tell these specialists to come to Guam because it's just too much. And so she felt that this bill would chase away and make it worse because, right, we're telling these doctors, come here, everybody's sick, we need you. And they're like, ah. And then this Bill 112, to a lot of the doctors, they just feel like it just throws a big red flag up for Guam.
Yeah, like I said, I think the system is broke. There needs to be it needs to be functional, but I think we can do it in a way, perhaps maybe we should talk about how to develop our healthcare where specialties don't exist, right? I think that's the gray area. I think also to preventive care, right? The responsibility of the patient to be able to take care of themselves, I think is so important. And it's very difficult, especially in underserved communities that are of low socioeconomic status. They tend to have more stressors, and that also ultimately affects their health. So yeah, the holistic way is the way to go, I think, in this way, as far as our healthcare goes.
Eat your vegetables, people.
Exactly. And before we even get to those states of diabetes, You know, there has to be being able to stave off those conditions by, eating healthy, having healthy lifestyles. It's easier said than done, obviously, but you know, that's something that really needs to be inculcated at a young age, and we need to start, yeah, yesterday. We should have started yesterday, but you know, that's something that I think we really need to move forward with. There's just so many needs in our community.
Right.
I think, the doctors definitely showed that, you know, like everybody else, they're stretched and overburdened. That, you know, we need to, that the public hearing was a way to relieve that. I could feel the pressure.
Right.
It was a way to, it was a way forward to healing too, in a way. You know, all the stress that they've experienced. But I think now moving forward, we do have to come together and figure out solutions.
I'll say. And so there are other bills being entertained at the legislature.
Yeah, I wanted to ask what happened to that medical, that hospital bill last week.
Yeah, so fortunately, I'm really glad that it was pulled back into committee. It received so many changes that it was substantively different.
Mm-hmm.
I think one of the changes that was made was that it would go over the debt ceiling. It would have authorized HEDA to go for bonds for $600 million, which is above our debt ceiling. The other issues with the bill, I feel, is the procurement model was the JFK model. And with the JFK model, I think they prioritize speed over affordability.
Mm-hmm.
And I think affordability is a huge concern. This is the largest undertaking of the government of Guam. $1 billion, over $1 billion we're going to spend. And we don't have enough to pay for it. They're going to have to look for additional grants. And I think affordability should be the focus at this point. I think the hospital, yes, I'm all for building a new hospital. It doesn't make sense to fix the current hospital. It's something that we really need, but I think we need to move forward very, very fiscally responsible, and we are obligating the debt for future generations, and we want to make sure that we're getting exactly what we expect. And I think the problem is the hospital committee hasn't come out with a report yet. And I would like to see that report come out to say what exactly are we looking to build before we obligate funds, before we tie up funds and tie up funds for the future generations as well.
Did that?
So this bill is very significant.
Did that bill kind of make up for the difference? Because we've all heard that the governor, was committed to the $300 million from ARP money. Did that kind of make up the difference? Because I think the Army Corps of Engineer report, the price tag was, I think, $700 million.
Yes, the bill was gonna do multiple things. It was
Mm-hmm.
gonna finance the additional funds that were needed. So the cost came in, and I believe it was actually the cost from the committee in the whole that was reported was over $1 billion. That's what was needed, and that includes both Department of Public Health
Mm-hmm.
facilities, and this is their whole inventory, as well as the whole inventory for Guam Behavioral Health and the whole inventory for GMH. So the idea was that this it was going to pick a developer to build this healthcare facility. So already the cost is an issue. I think there needs to be a reassessment of the cost, because we can't afford it right now. And considering that we don't know what's going to happen this past year was good because we received a lot of federal funds that helped to keep us afloat. But once the federal funds are phased out, can we expect our economy to pick up so that we can basically have enough funds in our general fund to pay for the obligation, the debt obligation. The other thing was that we're expecting EITC money to come in at $60 million.
Mm-hmm.
dollars annually. So initially the bill was going to take about 35 million for the first year, but then was going to rely on general fund for the subsequent years. And so really, does a general fund, can we afford to take the money from the general fund to pay for the debt obligation for the next 30 plus years? And I think that is a question, considering that our economy has not stabilized yet. So that there's definitely something to, this bill is definitely something to look out for. I know there's a public hearing July 23rd. So there's, definitely things that need to be ironed out.
Have you been also tracking this whole procurement for the new financial management system?
So I haven't been really looking at that recently. I know the last time we talked, it was an RFP, and it was, I think, Director Byrne had mentioned it's being reviewed by the AG's office, considering that it is over $500,000. The last conversation I had with Director Byrne was that it was somebody from DOA that's going to be in the selection committee. But then there wasn't anybody that I mean, from my conversation, it didn't seem like there were those that are in compliance with procurement law to participate in the selection of that. They would have to have completed the 4 modules of GCC. So that is something that I did bring up with the director. So I need to, look into that, follow up with him.
So we did actually have the AG on last week, and he had said that they were reviewing the guidance for the American Rescue Plan to see if the purchasing of a financial management system would be in line with what they're able to use the ARP funds for. But it's been an interesting saga with this because it's still an emergency, right? And this is an emergency that was declared last year, I want to say in December. And then there was a subsequent executive order that took the emergency procurement out of the chief procurement officer's hands and then put it into the Department of Administration's hands. And then now it's been passed over to the AG. So it's been kind of interesting to me how this has evolved. I don't know if evolved is the right word, or de-evolved as a process.
Right. So like what the chief procurement officer stated is that the RFP process is at the agency level, so they have control over that. I don't think it was necessary for the executive order to have basically eliminated the CPO from this if the RFP is already at the agency level. But I think that is interesting that was there must have been some issue with the CPO in regards to that. But I think, again, it's so important to have qualified staff to be involved in procurement. We really need that. That's utmost importance. Of course, the AG's involvement is important. That's always a safeguard, but I think that for those selecting, they need to be qualified staff.
All right. Did you have anything else?
Yeah. Rev tax. Is there something with the Rev tax, Senator?
Well, All Rise is, I guess they're going to be accepting applications. So there's an eligibility based on your income level, and filing if you did reach that income level. And I think a lot of the bottleneck, there's going to be a bottleneck with getting MERS verification, as you heard in the news last week, and that's going to be one of the issues in getting access to those funds. So just for the audience, just to keep working at getting that verification, and to apply. I encourage everyone to apply that meet the eligibility requirements. They did put a cap at 30 million, so it is a first come, first serve.
Do you are any of your colleagues looking at amending the law from 30 million to whatever else is needed, because that 30 million was just set on
private sector,
right, that were eligible at the time. And Senator Regine Bisco Lee is no longer in the legislature, so do you see or have you heard if anybody else is going to pick up the ball and?
I'm surprised she hasn't like chimed in. I mean, you would think that, hey, that's my baby.
Mhm.
Anyway,
Yeah, I haven't heard anything yet. Yeah, I myself would have to, think about this as well. Yeah, because there are other, and if you look at how the Azuda Imangafa program was, it was definitely underutilized, and I guess it had to do with also the application process, kind of holding things up a little bit. So maybe perhaps an extension. I mean, I'm wondering if there's going to be enough time to get all these applications in. But that's something worthwhile to look at.
I mean, you talk
I'm
about
sorry, Azita Mangaffa, this is the Amanda Shelton bill, or
Yeah.
we're talking about the Brugraman
Right.
Salapi?
no, the Judah McGoffa was that an $800 thing too?
I
Wasn't
don't
there
recall, but I
two?
know they set aside 10 million, but only
Right.
like $300,000 was used.
Yeah.
So a lot of it would have to do with the application process.
I mean, this is just, I don't even know what to say. The runaround with this RISE Act. And I really just feel like Adelup maybe is kind of out of touch. Maybe they don't get out much and talk to people, but people really needed this money back in December. And everywhere I go, Senator, everywhere I go, people are asking about it. And they're not stupid. They know that it's been something that was passed into law and that, the governor has just flat out refused to pay until she went and included the government employees and the retirees. So here we are.
Yeah, definitely something to look at.
I mean, if I had $1 for every time someone asked me about the RISE Act, we'd actually have enough money to pay it out today.
Yeah, it is. Yeah, I do hear constituents that you can see that they're in dire need. And some of the programs too, for instance, like the housing vouchers, assistance, a utility assistance program. I've heard stories where, they need the assistance, but aren't able to get it.
Yeah.
And you can hear that they are, really in need of this assistance. So yeah, it's, yeah, I definitely could take a look and see how we address how to expedite some of these things.
Thank you, Senator.
You're welcome.
Hey, have a good week and good luck.
Good luck tonight.
All right, thanks.
Okay.
You too.
I'll
Take
see
care.
you. All right. Yep. Thought I was going to watch Black Widow tonight, but probably going to end up watching this Bill 112 hearing. Might be a little more exciting, huh?
I wonder if they're going to do like time limits,
I wonder, yeah.
like last week.
Yeah. You want to keep it